100.9 FM, 1570 AM, WOKC, Okeechobee's True Country. We have the privilege of having on the phone lines with us this morning Dr. Stephen Sinatra, MD, cardiologist, psychotherapist, and best-selling author of Heartbreak and Heart Disease. Good morning, Doc. How you doing this, sir?
Hey, it's great to be here, Billy Dean.
All righty, sir. We go. Thank you for your time. By the way, where am I calling you at this morning?
I'm in Connecticut. Snow all around me. Nice and chilly and cold.
Yes, sir. We're low 80s here in Florida. You coming down to Florida anytime soon?
Oh, yeah. I'm jealous, and I'll be down there in a few weeks.
All righty. Good deal. Well, this is the perfect timing for this topic with, I would think, with Valentine's Day coming up. But I've heard of heartbreak from folks passing from heartbreak. You have a lot of senior couples where the wife will pass, and then within just a few months, the husband, and vice versa. Folks, heartbreak and heart disease, they say it can happen to anyone, even if you've never had any pre-existing heart conditions. Broken hearts are not just the subject matter of sappy romance movies and love songs. It's a real phenomenon. Broken heart symptoms such as chest tightness and shortness of breath can seem like a heart attack and often triggered by psychological distress that causes sudden weakness of the heart muscle. What motivated you to write this book, sir?
Well, as a cardiologist, I saw the exact same scenario you just talked about where, a spouse has been married for, 10, 20, 30, 40, 50 years. I've seen it 4 to 5 times in my practice where somebody has a sudden death or a heart attack, and the spouse within minutes on 2 or 3 occasions, and then the others within days, also died of a heart attack. And my suspicion is it's overwhelming heartbreak. One of the reasons why I wrote Heartbreak and Heart Disease was, as a psychotherapist, I saw the connection of the heart-mind-body connection. And I have to tell you, when heartbreak is overwhelming, the body releases, stress chemicals, cortisol, adrenaline, noradrenaline, and these stress chemicals can literally cause the heart to not only go out of rhythm, where you can get a sudden death from a ventricular, what we call arrhythmia, but you can get myocardial damage, a literal heart attack just from overwhelming heartbreak. And then years later, it was written up in the Japanese literature as Takotsubo syndrome, which is a real entity right now where the myocardium, or the heart muscle, literally has what we call a ballooning effect, and it has tissue damage from the heart attack. Now, the good news is a lot of these patients, if they get through the heartbreak, if they get through it and they suffer heart damage, they do survive. So that's the good news.
All right, sir, what are some of the things you can do to help with heartbreak?
Well, the most important thing is, if you have experience in it, is cry. I mean, my gosh, if you hold in the emotion and can't release the heartbreak, that can be a disaster. But what crying will do is not only will it help reduce endorphins, the feel-good hormones in our body out of the eyes, but crying also helps you breathe better when people sob, and it'll help to release what we call blood clotting mechanisms that occur in the lung. We call it thromboxane A2. I mean, these are chemical messages. So crying not only has physiological effects, but also has hormonal effects that can help save a person's life. So when anybody's experiencing acute heartbreak, the most life-saving thing you can do is to let down into that feeling, let down into that heartbreak. I'm speaking like a psychotherapist now, but crying can relieve the heartbreak that could eventually or suddenly lead to heart disease.
How important is a good diet also to help with it?
Oh, good diet's good. Boy, you're asking some great questions. If people eat a healthy diet with a lot of omega-3 essential fats, now living in Florida, people eat a lot of fish, which is really good. These omega fats, they can get inside of blood vessels. They can actually get inside of a plaque that's already there and make it make it more resistant to plaque rupture. So, any of these wild caught, I like smaller fish. I don't like big fish like tilefish or big grouper. I like smaller fish because they contain less mercury. And then it's flax seeds, nuts, seeds, onions, artichokes. These are all avocados. Boy, in Florida, avocados are great, and avocados are a great food, especially in this pandemic, because they support the liver as well.
Yeah, you've nailed two of my favorite, are salmon and avocados. And I like onions and the nuts, and garlic. So, most of those. Most of those.
Well, garlic and onions thin the blood, and they lower blood pressure. So those are two great ones as well.
Garlic and onions. All right. How important are meditation tools to also relieving heartbreak?
Well, during heartbreak, let's face it, the emotional stress can be overwhelming. But if people can do a little silencing, prayer, for example. If they can say prayers to themselves, this helps. Certainly meditation, and in the meditation, they can use a simple mantra like, the Lord is my shepherd, or they can use the word Om, which is really the resonance of grounding. We call it the Schumann effect. In other words, any of these little things that people can do can attenuate the overactive sympathetic nervous system, and they can bring the stress biochemicals down, and that's what you really want to do. You want to regulate the stress biochemicals down, and meditation will do this, and certainly, like I mentioned before, if you release the suppressed emotion through crying or sobbing, this will release these toxic stress biochemicals that can build up and cause problems like an acute heart attack or arrhythmia or overwhelming high blood pressure.
My daughter's a certified yoga teacher, has been teaching yoga for almost 6 years.
Oh,
and
great.
She tells me that her classes have helped so many people in as far as lowering their blood pressure and helping them to relax and chillax.
The best position I have found in my cardiovascular population over decades, and tell your daughter this, is the cobra pose, where you lie on the floor, you arch your back. It not only helps to relieve back pain, but it's just one of those best poses to release emotional stress. And I do it every day for at least 1 to 2 minutes when I work out in my basement. I always do the cobra pose. It's phenomenal.
All right, also, some of the other talking points they've suggested you tap into emotional healing. Release suppressed emotion. You mentioned cry. Okay, we've covered that. How about relaxing with natural mood boosters like dark chocolate?
Oh God, dark chocolate. Yeah, dark chocolate. Anything over 70% dark chocolate. And if it's an organic dark chocolate, I like that even better. But dark chocolate, and the darker the better. So if it gets a little bitter at 85 to 90%. But dark chocolate contains the chemical, or it stimulates the brain chemical through its polyphenols. That's called phenylethylamine. Guess what? That's the love hormone. So isn't it amazing that during Valentine's Day, people for centuries have been given chocolates? It's just incredible. But the darker the chocolate, the better, because again, it stimulates that love hormone, which we all need, and it can rescue a lot of people from emotional situations, because dark chocolate literally in some people can help to open their heart to love, which is really good, really cool.
Now, we all know stress is a bad thing, but how bad can stress be on your heart?
Well, I'll tell you, as a heart specialist, stress not only can cause arrhythmia, heart to go out of rhythm, it can cause overwhelming high blood pressure, it can cause sudden death. I mean, one of the reasons why I became a psychotherapist, and I studied psychotherapy, I studied 2 years of Gestalt and 8 years of bioenergetic therapy, is that when the Vietnam War was winding down in the Hartford area, we had the Groton sub base and a few miles away, Colt firearms, Pratt & Whitney aircraft. And it was amazing, Billy Dean, but I got to tell you, I was working in a cath lab in my 30s, doing coronary angiograms, and I couldn't believe the amount of heart attacks I saw in young men in their 30s, and it was all due to overwhelming emotional stress. And that's one of the reasons why I decided to become a psychotherapist as well as a cardiologist, because people look at the brain and they look at the heart, but they are connected. They are so connected, and you just can't treat the heart without treating the brain. So, during these pandemic times and during times where we're lonely, we're depressed, we have to really consider, outlets for emotional stress. And, whether you exercise or whether you do grounding or whether you cry or whether you do yoga, any of these things can help to, rescue the mind-body connection.
Where do you see supplements playing a role in emotional support and stress reduction?
Well, supplements are important. Omega-3s are important, again, because it makes these, gets inside a plaque and it makes them more resistant to rupture. I certainly like astragalus. I love ashwagandha. Ashwagandha is, one of these supplements coming from the Far East that basically can help lower cortisol. I've been taking ashwagandha myself for 20 years. And I only take low doses, but I think it makes a difference, and also helps with sleep well. And remember, people have to realize that sleep is very important. We release melatonin during sleep, but during the pandemic, a lot of people are stressed out, and the more sleep disorders are occurring. So, sometimes these adaptogenic herbs like ashwagandha can help.
Are there specific questions that we should be asking our doctor or yourself related to heart health, even if you have never had a history of heart health problems, but still feel a tremendous amount of stress?
Well, one of the most important things that people should ask their doctors is if they're developing a new sensation in their body, during these stressful times that they haven't been privy to. For example, if they're developing any chest discomfort or any, jaw discomfort or discomfort in the shoulders where, it could be coming from the heart. One symptom that I really worry about is when people are awakened in the middle of the night, short of breath, for example, and they have to sit up, and all of a sudden the sitting up helps to alleviate the shortness of breath. This can result from what we call, mild congestive heart failure, or what cardiologists call diastolic dysfunction. But if symptoms occur at night, they need to be investigated. And if anyone has substernal chest pain or radiating into the arm or associated with shortness of breath, that can be a sign of, heart-related or a cardiac-related situation, or even a full-blown heart attack. So, any of these symptoms, people should, at least communicate with the health professional.
Now, you're a cardiologist, psychotherapist, and certified nutrition specialist. How do all of these specialties merge, and why did you decide to pursue an education in nutrition and psychotherapy as a cardiologist?
Well, because it's so diverse. I mean, improper diet can lead to heart disease. Stress can lead to heart disease. So, as a cardiologist, I realize that, people put in, crazy foods. They'll eat trans fats, for example, or, they'll be taking in GMOs in their diet, and this can affect the diet. And blood sugar is the most alarming situation that I've seen as a heart specialist. Billy Dean, we have almost 100 million diabetics in this country right now, and people are overweight. They eat a lot of sugars in their diet, and they stress out the pancreas, and this is a problem. And remember, one of the worst comorbidities to have during this pandemic is not only overweight status, but if you're overweight by 20, 25 pounds and have type 2 diabetes, now you're in double handcuffs. So the best thing I can tell your listeners that, during the pandemic, please eat less sugars, get a little more exercise, try to reduce weight. And if you can do those things, at least you'll be taking away some of the comorbidities, because a higher blood sugar is a good, environment for these viruses to lock into your lung and to lock into receptors. And so the lower the blood sugar, the lower the weight, the lower the use of carbohydrates and sugary foods during this pandemic, the better you can adapt to it. No question about it.
All right, before we wrap the interview up, I'd like to ask you, where can our audience learn more about your books and supplements that you've recommended this morning?
Oh, they can go to, drsinatra.com. I work for a great company called Healthy Directions. Oh, my gosh, I've been there for almost 30 years. And then there's Vervana.com. That's my healthy food website where, I have these non-GMO organic foods. But the last name is Sinatra. I have my own pasta sauces. I get from Italy and stuff like that. And I'll tell you, pasta, if you eat a high-protein pasta, Billy Dean, you know what I mean?
Yes, sir.
Because it's vegetarian, if you get a lot of protein in the pasta, you don't get the insulin response that you do that you get with high-carbohydrate semolina pastas. Right. So I like chickpea pastas. I like red lentil pastas, and if you have a great tomato sauce, and lycopene in tomato sauce is awesome for the heart. Yeah. And I'll tell you another quick thing. If anybody takes in tomato sauce, if they have pasta or dinner, please eat some broccoli at the same time, right, because the sulforaphane in broccoli and the lycopene in tomato sauce, it's a knockout punch for prohibiting, let's say, prostate cancer in a male, or, even lessening the incidence of breast cancer in a female. So, nutrition is a world of science. I love it, and I'm so glad I got certified as a nutrition specialist, because it was lacking in my training as a cardiologist decades ago.
Well, Dr. Sinatra, we thank you very much for your time. Very important stuff for our listeners. We do appreciate it, and enjoy your trip down to Florida. Look forward to maybe catching up with you another time, but we do thank you very much for your time this morning, sir.
Thanks so much, Billy Dean. God bless. Bye-bye.
Have a great day, sir. Bye-bye. Dr. Stephen Sinatra, MD, cardiologist, psychotherapist, and best-selling author of Heartbreak and Heart Disease. We'll be right back. More of Okeechobee's True Country in just a couple of minutes.